Luca and I are thrilled to welcome Will Ferguson, founder of the Caring Physio. Hi there, Will,
Hi, thanks for having me today.
coming along and talking with us. So I think a really good place to start would be to find out more about led to the creation of the Caring Physio.
That's a very good question. So I became a physiotherapist in 2007. Wasn't really sure what I was going to do. Did a gap year, came back from Brazil and decided to do a degree in physiology. And then I hurt my knee playing rugby, which was a bad idea at the time, and decided that actually I'd like to pursue a career in physiotherapy. So I did a master's degree at the University of Brighton for 2 years and really enjoyed myself. And then I went out into the world of the NHS, working in a busy hospital in Reading at the Royal Berks Hospital, and learned a lot, got a very good experience of all the different things that physiotherapy does in hospital settings with discharge planning, doing orthopedics, neuro. Really enjoyed that. And then I looked for a slightly different change, going into a private hospital where people were coming in for surgery. And that's when I went on the wards and I was able to use some of the skills that I had learnt in the district hospital to do discharge planning. And I think that the initial realization back in about 2011 was that people were going home to get care if they needed some more support at home. But often the physiotherapy might be anywhere from 2 weeks to 8 weeks. And it kind of dawned on me that the older you got, the less you could afford to wait for someone to come and get you moving again. Other people think physiotherapy is about, treating a sore back or getting a muscle working again or reducing pain. But a lot of the stuff that we do in hospitals is getting people on their feet again and helping people to get their independence back.
Another question. What do you think is behind that delay in getting physio? Because say if someone needs a bed delivered to their home, if they're coming home after a hospital stay, they can deliver a bed the next day. Why can't they deliver physio the next day?
Yes, that's a really good question. And I wasn't sure initially. I think the way our hospitals are, the way they function is that they need to clear the beds and there's just not enough space. So the average age of hospital admission now is 65. So it's getting older. And we are having a situation where we're living longer and we just can't cope with the support that people need. So normally to get someone out of hospital, they need to be medically fit. And then the people in the hospital need to assess the person's need if they need care or they need equipment. So often it's been a case of, can they get the right equipment like hospital bed and any moving and handling equipment that's required to get someone out of bed, and then care. So if that's in place, they can go home. Physiotherapy isn't an essential need. I think they feel that as long as they've got care and they're safe, we need to get someone out of hospital because we just don't have the space. And particularly this time of year when the winter pressure starts building, where more people are getting sick, there's more falls, there's more fractured hips. That's when the hospitals really struggle. So I just don't think there's enough funding and there's enough of an emphasis on community physiotherapy. And partly that could be down to our society's view that we shouldn't be maybe spending as much money on people of a certain age, whereas people should be spending more money on younger people. So I think that's partly why we're in this situation. But also we have a lot of additional pressures since then. So it was never really that good when I became qualified and I picked it up then. Imagine what it's like now when we have the COVID pandemic to deal with, Brexit. So we have a problem with workforce and also just a lack of long-term planning from the government of what we're going to do with the NHS and how it's funded. So that was where the concept came of, do you know what? I think we can do something about this. I think there are people who'd be willing to self-fund to get physiotherapy. Like if my dad went home after a broken hip and I was told it could be 6 to 8 weeks, I would probably want to try and find someone to come in and get him moving if he couldn't walk. And I'd be very concerned the long that window goes without him getting the right intervention, even though he might have care, he might not be able to get back to where he was before he fell and broke his hip. So it was actually lockdown that really got me thinking that in my role at the time, I was working in a GP practice. I'd been abroad for 6 years. My wife got a job in Kenya and then we moved to Burma. And I was doing a bit of expat physiotherapy and doing some home visits for people in Nairobi. And I was traveling around and I realized actually it's very convenient for someone to turn up at your house and give you physiotherapy without you traveling. So when I came back to the UK, I kind of reconnected with some of my contacts and I did some work in care homes and also seeing people in the community. And I just realized the timing of COVID really made us decide, why don't we set up the Caring Physio? Why don't we actually run a family business where we can decide the values of the Caring Physio, where we can go out there and provide physiotherapy for people that really need it. So we set up in June of 2020 during lockdown, which was challenging, but back then it was even more of a need for people to get help in the community because the NHS wasn't functioning as it could.
And it's a great name, the Caring Physio. Just does exactly what it says. What's your client base? Is it mainly older people looking for reablement? Do you still support people with sports injuries?
Yeah, so all our physios are very generic and we've got a very good experienced team. But because we only do home visits, we tend to deal more with people who are older, who are struggling to mobilize coming out of hospital. But that's what makes us different, the fact that we do home visits. And there's something special about going into someone's house and treating them than them coming into a clinical environment like a GP practice or a hospital. And actually the people who are 75, 85, 95, it's very hard for them to get into a car, to then arrange transport, get into a GP clinic, sit around and wait, and then see a physio in a situation that's more suited for a kind of sports injury clinic. So yes, most of our work is working with older people. 60% of the work we do is home visits, and 40% of our work is visiting people in care homes. So those are the two kind of areas of our business that we focus on.
What are the most common problems that you come across?
So the most common problem that we see is normally as a result of people being in hospital for too long. So someone's gone into hospital and they've had some kind of treatment, and because they've not been themselves, they've not been able to mobilize as well, the time that they spend in hospital normally means they come out weaker. So we call that deconditioning. So it might be that someone falls over and hurts themselves. They don't always end up breaking something. They might find that they have an infection. So a UTI is quite common, or a chest infection. They might have fallen over and broken their hip. So we see a lot of hip fractures in the community. We see a lot of people with dementia. We see a lot of people who, as the dementia advances, they start to lose their mobility. We see people with Parkinson's. We see people with other neurological disorders like strokes. So it's quite varied. But as I said, it's often after someone's gone into hospital and they haven't moved very, very much in that time. And if you're in hospital, you really want to question why you're there if you're not getting some kind of active, life-saving medical treatment. If you're not, and you spend a long time, there is a chance that you could actually get sicker, maybe even pick up an infection from the hospital. That's probably our biggest challenge is trying to support people as they come out of hospital and get in there quick enough before they decondition to a point where they need hoists or they fall again and hurt themselves further.
Some type of interventions are typical when you're visiting older people with deconditioning, and how do you look after people that have dementia and other cognitive sort of problems? How do you sort of work with them, given the cognitive, maybe memory issues?
Most of the people we work with have an element of care. So whether it's in a care home or they've come home with live-in care or elderly care, we would go in and we would often have a conversation with the family. Often the referrals come from a concerned daughter or a son, and we would establish what the main issue is. And then we go and meet them. The physio goes into their home environment, makes them feel comfortable, explains what we're going to do. We're going to do an assessment today. And the main aim is to really understand what their problems are. So whether it's a physical problem where they've fallen and they just don't have the strength to even stand up. So we might assess them in a bed. We might assess them in a chair. We want to do a physical examination of how strong are they? Can they move their arms and their legs? Can they roll? Have they got any core muscles? Often what happens when you're in bed too much or you're not able to stand is you lose your balance. So can they actually sit on the edge of their bed and get their feet to the floor and actually have the muscles to sit upright, or do they start to lean back and they're not safe? So we establish all these baseline markers, and then we start putting a plan in place to say how we can come in regularly to then start doing these exercises and work with them, work with their family, work with their carers to give them the opportunity to get stronger. So one way is to try and stand them up and walk them. But if they can't stand, haven't got the leg muscles, we might have to start by doing exercises in the bed, in the chair. We would put an exercise plan together, share it with the family, teach the carers to do some of the exercises if they're able to do that. And then step by step, we just try and progress them towards their goals. So that's kind of generally how we work. And it's not just the physical side, it's also the mental side as well. So we're dealing with people that have lost their confidence. We're dealing with people who feel a bit worthless. They might feel isolated. They might be struggling with depression. If you then add into the cognitive issues that are out there and people have issues with their memory, they're anxious, they can't remember what's happened to them, it becomes a bit more challenging. But it doesn't mean that we can't support them and treat them like a younger person. A lot of our patients, they really appreciate the time that we spend with them to build a relationship and a rapport. And if you give people time, they actually can improve. Maybe we don't get people walking around independently. Sometimes it does happen. But if we can improve some elements of independence, then that can go a long way for someone who could be within the last 2 or 3 years of their life. So if we can try and improve their mobility, get them out into a chair, then that opens the door up to them having a better quality of life.
When families start researching and looking into physiotherapy, what questions would you recommend that they ask?
That they are part of the Chartered Society of Physiotherapists, which is our chartered body. Also to be part of the health care professional body, so that they are officially licensed and can practice in this country. But also looking at their experience. So what kind of experience have they got? Are they a physio that might be able to treat the type of issue that you're looking for? So have they got a neurophysiotherapy background if it's someone that needs stroke rehab? Have they got experience working in orthopedics if they've got a fracture? But I think the key thing really is that you've got an element of trust that that person can come in and assess your loved one to see how they can help really. And I suppose that starts from the beginning of the process, the communication, how you engage with that person on the phone, maybe look at their website. All these things should be clearly highlighted about the type of physio that you're going to meet. So those things I think are quite important. And also, what type of person do you want to come in and look after your mother? Is it someone that looks like they're caring and they're interested and concerned? I think that's also important to consider.
So does a typical program look like for someone whose capacity to sort of walk in and they come home lacking confidence? How often do you go and visit them? And then if you're working with the family and the carers, sort of how many times a day do you sort of recommend exercises and realignment activities?
Yeah. So we would go into the home and assess them and set up a plan. And again, that plan could be a combination of trying to get someone moving. So there might be some exercises that involve stretching, but also strengthening. Physios might do a bit of hands-on work as well. So quite commonly we see people that have fractured their hip and they've got a bit of lateral pain down the side of their leg, a bit of swelling. So we might do some soft tissue massage to their leg, to their hip in bed. And then we would do functional physiotherapy. So there has to be a functional element. We can just go in and do the exercises and go. You have to try and encourage them to be able to have the balance to maybe walk to the toilet, maybe to go into the kitchen to make themselves a cup of tea. If they need to get out and see a doctor's appointment, how can they get outside? What kind of walking frame do they need to use inside versus outside? Do they need a wheelchair? Can we get them down the stairs or the steps to get access to the car? Can they get in and out of their car? And then some of the exercises might be working with the carers to show them the best way to encourage someone to get in and out of bed without the carer having to do too much work with their hands. So if someone can lift their legs into bed, but it's a struggle, that's better than for a carer to lift their legs up in for them. So it's about enabling them to do more for themselves. And the way we work with carers is we try and find good care providers where we can do some joint assessments. And if we can, teach them some of the exercises they can do. Because the more that someone can do during the day, the more beneficial it might be for them. Typically, we might see someone up to 3 times a week if they've come out of hospital and they're very, very weak and they can barely stand up. But more commonly, we start maybe twice a week, once a week, and we might keep them there for a while. We might reduce the amount of input from us. But if the carers are able to do the exercises twice a day, 3 times a day would be amazing. But even once a day, that could significantly increase their muscle strength, and that could be very beneficial for them. So yeah, it's also working with the families. If we can show the families a few little things they can work on, it can be really beneficial too.
Sometimes carers can be sort of reticent to be involved in the exercises because they worry that they might hurt their clients, or there might be the risk of falling, or they might be doing the wrong thing. But how do you sort of work with carers to help them get around that and to think about it?
Yeah, absolutely. We see this a lot, particularly in care homes. That people are a bit risk averse and they're worried that if someone was to fall over on their watch, then they would be blamed. And physio do take more risks because our job is to try and get people to walk again who don't have the strength. I think the answer to that question is to get to know the carers involved. And the more time we spend with carers to show them what can be done, then it builds up their confidence as well. And it's also just having the right approach. Like, we're not judgmental. We're not trying to come in and tell the carers what to do. We're actually there to help them. So it's understanding their level. So where do they lack the confidence to walk someone or do the exercises? It might just be they haven't done it before, and we just need to upskill them and build up their confidence as well as the person we're working with. It might be that we get involved with the assessor for the care provider or the moving and handling trainer, and we look at ways to maybe support them in the office or to kind of problem solve other similar issues that might be a problem amongst other clients that you have. So there are different ways of working, but I think the best thing is just to be with them and to show them what can be done, and then just make it very clear where the boundaries are. Don't worry about that. That's something we can do, but you can do this exercise in this environment because it's safe, isn't it? If you stood someone up with a frame and there's a chair behind and you got them to maybe hold onto the frame and lift one leg up in the air, and you hold that as long as you can, the worst thing that could happen is they'd be a bit wobbly and they could sit down in the chair behind them. If you did that in the middle of the lounge, not holding on to anything, that's too risky, isn't it? So just being really clear what we would like the carers to do. And if there's an issue, they just need to communicate with us so we can explain it to them.
Now, Will, I know how passionate that you are about what you do. What are the areas that you would most like to influence?
Yeah, so I think just the culture of how we value older people in our society. As I said earlier, I think we do have a very ageist mindset when we deal with healthcare. I do hear, unfortunately, some sad stories where GPs are putting people off getting joint replacements because they're too old and it's too late and things can go wrong. So I'm not sure how we can directly have an influence on that, but just by advocating that just because you're towards the end of your life doesn't mean you can have all the same access and quality to what's out there for someone younger. By having a company that really specializes in that area, I think we're showing people that actually you are worthwhile and you are valued and you should be getting intervention. To hear, we probably don't need to get an x-ray because they've fallen over and they're in a care home and they've got dementia. No, if that was my son or my mother, I would want an x-ray. I want to know that their finger's broken or they might have fractured the rib. Even if the treatment doesn't really change, I think we should treat people equally. And dementia is on the rise as we live longer. We're now told that 1 in 3 people born today will have dementia. So we need to change our approach of how we look after people. I think we need to get in and see people faster. And I'm not sure how that really works at the moment without spending more money on healthcare. But to have more influence in care homes as well is very important, because every care home should really have access to regular input from physiotherapists and occupational therapists, because there's a lot of things that can be done to stop people deteriorating and requiring more care than they need, to give advice on the type of equipment that's out there. Things like specialist seating is very important, and there's quite a few grey areas on how the NHS supports people in care homes. But yeah, I think the problem is just going to get worse, sadly. And I just worry about the fact that our culture doesn't really do very well with looking after our relatives. I think we're told to go and get your own house and look after your own career. But then if you're a few miles away from where your parents are and they're falling over and they're starting to show signs of dementia, who's going to look after them? And I think, yes, you can put people into care homes or get them to have care, but it does worry me that we just don't have enough people at the moment working as carers and as physios and doctors and nurses and OTs in healthcare. So I'm not really sure what the quick solution is, but I think we're going to find that there's going to be more of a demand placed on companies like ours that do rehab in the community and companies that do live in care as well, because people want to take control and decide that they want to actually get some input now instead of waiting. So the danger of the NHS is that there's always a wait. Often when you do get help, it's good, but that gap, as I said before, often is too long.
And what's next then for the Caring Physio?
We are expanding the areas that we reach. We cover Berkshire and Oxfordshire very well. We're into Hampshire. We're in Surrey. We're in Buckinghamshire. We're going into Warwickshire and now into London. So all those areas, we've got room for growing a team, getting more physios that are really passionate about the work that we do. But I think the problem is the same everywhere in the UK. You could be down in Cornwall, you could be up in Scotland, you could be in Wales, and you'll find that there are similar issues with people getting access to physiotherapy. So we would like to expand what we do, but we also want to do it in the right way so that we have excellent people working for us. We've currently got 14 care home contracts, and another part of our business growth is to do more work with care homes who want to invest in some of the suggestions that we have to maybe do more training for carers, to have a look at some of the equipment that they're bringing into care homes, and also just trying to be proactive and not reactive to what's in front of them. So there's definitely an area to expand on getting involved in more care homes, but also all the people that need community physio. I think that's just the demand will grow as time advances. I'm not sure what the current government's plans are for adult social care, but it's not looking great at the moment. So I think there'll be more demand for us to help more people.
Thanks, Will. Can you tell us what's best for people to get in contact with you if they want to find out some more information?
Yes, so we've got the website. The easiest way is to go to www.thecaringphysio.co.uk. And on there, you can see the areas that we cover. There's a contact number. We also have a good online form that you can fill in with an inquiry, and we can get back to you, find out a bit more about your issue, and see if we have the capacity to send a physio to come out and help you. So yeah, our website is the best way to contact us.
Wonderful. Thank you very much.